So let's dig in a little bit on the migraine market. In the early 1990s, Imitrex was approved. It was the first triptan. This is the class of drugs we're using. The first triptan approved by the FDA, first on the market. As soon as that was brought out, it took over the prescription migraine market. This is the class of drugs that is really the gold standard. And Imitrex, which has sumatriptan as the active ingredient, is the gold standard of that class. So we chose sumatriptan to put into our patch because we don't want to fix something that doesn't need to be fixed, and we put it into a better way of delivering that treatment. Patients, when they have trouble, and often it's GI issues, with a particular drug, usually it's a triptan, move on to a second triptan, or a third, or a fourth. It really is where the vast majority of patients get their medication for migraine. So let's look at what's the point here. We talked about migraine-related nausea. That is really the commercial driver for us. That is the big one, and we'll go right out of the gates with migraine-related nausea, and we're effectively addressing that with a number of the patients and physicians now. 90% have nausea with migraines. Not all the time, but sometimes. Almost 60% vomit. So why are we developing oral treatments for this disease? It doesn't make a lot of sense. So that's pretty intuitive to most people. Makes sense to have a patch. The other thing is gastroparesis. This is not quite as well understood. The science has not been as well developed. But what happens is, with migraine, it's part of the disease that your absorption can be slowed or paralyzed in the gut. So what we have here is not a disease just of the head. It's what we think about, big headache. It's a lot more than that. It's really a disease of the gut as well. And the experts in this field are really starting to understand this better and do more research in this area. And it's an area that we, NuPathe, really want to be and are the leader in. No other product really hits this sweet spot. This is ours. We intend to own this space. We are the GI migraine company. And so what we can do by avoiding this oral delivery is avoid the inconsistency that you have with a slowed down or paralyzed GI tract. And then last, triptan adverse events, as we call them. There is an injection. Actually, that was the first triptan introduced into the market because there was a recognition that there are GI issues with this disease. However, the problem with injection is, aside from the fact that patients typically don't like injection, when you deliver so much drug so quickly in an uncontrolled fashion, you can picture an injection peak, you end up with more triptan side effects in this case. They are what's known as the, quote, cardiovascular concerns, meaning these are vasoconstrictors, these drugs, and patients then feel a tightness of the chest, paralysis or tingling down the arms, numbness of the nose, things that mimic a cardiovascular event. It's very scary to physicians and patients. We can, with the technology we've embedded in our patch, deliver an efficacious amount of drug and then hold it at that level. So we don't get those peaks, and our data now demonstrate very clearly that we practically eliminate these triptan adverse events. It's a really big deal. So as we look at the opportunity here for this patch, and there is clearly overlap among these numbers. We don't know exactly what the overlap is, but when you think about it, the more overlap there is, the more likely that is a patient for this product. So these numbers get pretty big, and if you'll note down there on the bottom, you see comorbidities, and they are GI issues. Some of the people that understand this disease of migraine the best are actually the GI doctors. And the reason is, when people come in to see them with IBS or other GI issues, they often have migraine, and these physicians have noted that. And they are actually studying gastroparesis. They're way ahead of the migraine doctors in this area. We've now brought those two together, and it's really pretty exciting from a scientific perspective as well as from a product perspective for us. So as I mentioned, MRN, remember that term, MRN is a key commercial driver for this product. About half of migraineurs have nausea from the disease, not caused by the treatment, from the disease that makes it difficult for them to treat, either on time or at all. That's the sweet spot right out of the gates for us from a launch perspective. And what you see, there's a lot of data that we've been digging up, that we didn't have to do those studies. There's data out there that show nausea really is a predictor of poor response to oral treatments. So when you think about it, you're a physician, and you've got a patient, and you find out they have nausea. Why are you going to prescribe an oral treatment when you know that the likelihood is if they have nausea, they will respond not as well to an oral as they will to a non-oral? It's a great opening for us. And when you think about the numbers, it's about 7 million patients in the US alone that have nausea to the point where it affects their ability to treat.